Picture this: a Los Angeles operating room filled with bright lights and a sense of anticipation. Doctors are not just repairing, they're actually constructing a new future for organ transplants. Just recently, something happened that might mark the start of a new chapter.
As of today, 2025-05-29, the world's first human bladder transplant is a reality. It reads like something out of a novel, but it took place only weeks ago at UCLA. Let's talk about why this is such a big step for medicine.
There are two things at play here: the complexity of the procedure and its impact. The team, led by Dr. Nima Nassiri and Dr. Inderbir Gill, managed to transplant not only a kidney, but also a bladder into Oscar Larenzar. He'd lost his bladder to tumors and his kidneys to cancer and end-stage disease. So they weren't just swapping one organ, they were restoring an entire system.
Exactly. And transplanting a bladder isn't just about putting it in place. The organ sits deep in the pelvis, surrounded by a web of blood vessels, and has to work as part of the urinary tract. What changed? Why did this finally work after so many failed attempts over the years?
Preparation made the difference. The team invested years in developing their approach, including rehearsals on donors who were deceased but maintained on ventilators. One key step: they pre-connected some veins and arteries before placing the bladder. That let them handle the tricky blood vessels more efficiently. So, when they finally operated on a living patient, the new kidney started making urine, and the new bladder was ready to handle it right away.
And no dialysis needed after surgery. That really shows how well the new organs work together. But why has it been so hard to transplant a bladder until now?
It all comes down to blood supply. The bladder isn't just a simple sac. It's a vascular organ buried deep in the abdomen. Getting it to survive after transplant meant overcoming a lot of challenges, not just surgical, but also immunological and vascular ones.
Up to now, patients with severe bladder dysfunction usually had a piece of intestine used as a substitute. But that method brings its own set of problems. Can you explain why?
Sure, when you use intestine to replace the bladder, you're introducing a different microbiome. The result? About 80% of patients face complications, things like infections, stones, and sometimes even cancer. A real bladder transplant could sidestep most of those issues.
So the obvious question: how soon could more patients see this benefit? Was this a lucky one-off, or could it become a standard procedure?
We're not quite ready for that yet. The results are encouraging, but we need more clinical trials and longer-term results. The team is rightly cautious. They want to be sure the benefits last, not just in the short term. But if this holds up, the impact could go far beyond just bladder failure. It could change the outlook for other difficult organ transplants too.
And there's the broader issue: the global shortage of donor organs. If this technique works for bladders, is it possible to adapt it for other organs? Or maybe even influence how we approach regenerative medicine?
That's the direction people are looking toward. Success here could inspire new ways of handling other organs, especially those that are structurally complex. It's not just a win for one patient. It could shift the whole field.
So to wrap up, we now have a patient with both a transplanted bladder and kidney that are functioning, a surgical technique that could shift the practice, and a hint that organ replacement might be closer to a new era.
The significance of this first human bladder transplant goes beyond setting a record. It could shape future treatments. The real question is whether we'll see a wave of these procedures soon.
That's what we'll be watching for. Thanks for joining us as we broke down this milestone in medicine.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it now, free of charge.